to the June 14 open session of the Risk and Audit Committee. I call the meeting to order and would ask that we begin with roll call.
Lisa Middleton.
Present.
David Miller.
Here.
Sertan Usamas for Fiona Ma.
Present.
Jose Luis Pacheco.
Present.
Ramon Rubalcava.
Present.
Karen Green-Ross for Betty Yee.
All right. Our first order of business is an executive report from Mr. Kevin Fine.
Good morning, Madam Chair, Mr. Vice Chair, committee members. Very nice to be with you this morning. I'm Kevin Fine, CalPERS team member and Chief Compliance Officer. I have a number of things to share and discuss with you today. First, in the action agenda items section, we are bringing the Enterprise Compliance and Risk Annual Plan, the Office of Audit Services Annual Plan, and the Independent Auditor's Annual Plan for your review and approval. Second, under the information agenda item sections, we will be submitting our fiscal year 2021-22 annual compliance report, and I'll be providing a high-level overview. The next Risk and Audit Committee meeting after this is scheduled for November 16, 2022, and it will include, per the draft agenda, the Independent Auditor's report for fiscal year 2021-22, the review of the Independent Auditor's management letter, and Chief Compliance Officer update on preliminary plans. This concludes my report. Happy to take any questions.
All right. Are there any questions for Mr. Fine at this time? Seeing none, we will move on to action consent item 3A, approval of the June 14, 2022 Risk and Audit Committee timed agenda. Is this a voice vote?
Yes.
Okay. All those in favor, please say aye.
Aye.
Any opposed? Any abstentions? It's approved. We will move on to item 3B, approval of the minutes of the Risk and Audit Committee for 2022, or April 18, 2022. All right. Second, all those in favor, please say aye.
Aye.
Any opposed? Any abstentions? All right. Okay, 4C. Thank you. Next is information consent items. Mr. Fine, 4A.
Again, as I just mentioned, the next meeting of the RAC would be in November, and you can see the items proposed to be listed for discussion during that meeting.
All right. 4B, draft agenda for the November 16, 2022 Risk and Audit Committee meeting.
And again, a few of the items I mentioned, and
Okay.
Happy to answer any questions about the draft agenda.
Any objections? All those in favor, please say aye.
Aye.
4C.
Chair Middleton, these are consent items that don't require a vote, and I haven't heard that any of these have been pulled for discussion.
Thank you for the reminder. We'll move on to the quarterly status report, Office of Audit Services. And that's information, okay. Are there any other items that anyone would want to pull? Seeing none, we have a public comment for 4C, Mr. Jelensek.
Good morning, J.J. Jelensek. I'm asking these questions on behalf of the public because, unlike the board members, I assume that most of them have not read the consent item material. But in 4C, which is the response to the management audit letter, observation 1 deals with the segregation of duties related to oversight of dormant accounts. The update says that it's resolved, and then goes, at the end, it says, further assessment and analysis are in progress to formally update any security rules in my CalPERS that may be needed. And it just struck me that there was a contradiction between saying it was resolved and saying we're doing further research, and so I was hoping you could share some enlightenment on that issue. And then the other observation was number 2, which is the death benefit over payment receivables. And there's never been an explanation as to how CalPERS lost its access to the Social Security full file of death information from the death master file. And I was hoping you could give us some insight as to what happened and how that was lost. Thank you.
Thank you. Are there any other further comments?
I was hoping that I might get some response, although I know you typically don't respond to public comments.
As in the course of the reports of the staff members, there will be responses.
Okay, thank you.
I can do it. I can do it. Chair Middleton, I can respond to Mr.
All right.
Jelensik directly. I'll follow him out.
Please go ahead.
I'll just jump on number 5.
All right, we will continue. Action item 5A, Enterprise Compliance and Risk Management Plans. Mr. Fine.
Thank you, Madam Chair. This item is the submission for your approval of the fiscal year 2022-23 Annual Enterprise Compliance and Risk Management Plan. The 2022-23 plan is designed to continue CalPERS momentum in expanding compliance and risk management standards and frameworks. For the upcoming year, enterprise compliance and enterprise risk will focus on the following areas: enhancing our inventory of requirements and controls to support compliance and risk management practices. This is a multi-year project and initiative and will involve both what we refer to as the first line of defense, which is the actual business units across the enterprise, as well as the second line of defense, including compliance, legal, information security, and other partner areas. It will enhance oversight and monitoring capabilities to minimize compliance risks, and consistent with a lot of the initiatives over the past 5 years, will continue to educate CalPERS team members to continue to cultivate an ethical and risk-intelligent organization. This concludes my remarks on the 2022-23 plan, but I'm happy to take any questions prior to your vote.
All right. Are there any questions for Mr. Fine? Let me begin. Mr. Fine, one of the issues that we've had the opportunity to talk about is some of the challenges that are presented to auditors because of the move to remote working. Could you give us an overview of those challenges and your initial thoughts on how to approach dealing with what is effectively a very changed workplace?
Yes, I've spent some time prior to joining CalPERS and between the last private sector corporation where I had broad compliance responsibilities, looking at what the industry was doing throughout this period of the last 2 years. I think when I look at the work CalPERS has done coming out of the current and nearly finished 5-year strategic plan for 17 to 22, and then look at the steps that were taken, the technological capabilities that were developed, et cetera, by CalPERS during the pandemic, I would say I don't see CalPERS having nearly the type of challenges based on its business model as many of the financial services corporations where I worked in the past, in particular where people were engaging with clients as salespeople and trying to convince an individual or a corporation in the institutional sector about the value of a particular transaction. I don't know if you all are familiar with the suitability requirements on the street side that are come from several federal regulators. But as I look at CalPERS type of business activities and the way they've been conducted over the past 2 years, I think there are certainly some challenges, but I don't think they're insurmountable. I think I've seen, I think I talked about in April, the total number of audit reports I've been reading going back over several years. And I think, in fact, CalPERS is addressed very well. And I think with some new folks on board in addition to me and having some good team members to collaborate with, I have a fairly high degree of confidence that the hybrid remote situation that we brought in beginning in March is really not a terribly insurmountable barrier to good corporate governance, oversight, routines, et cetera.
All right, thank you. Are there any other questions for Mr. Fine? So this is an action item. Do we need a voice vote or a recorded vote?
Voice vote.
All right, is there a motion? Mr. Pacheco, second. All those in favor, please say aye.
Aye.
Opposed? Abstentions? Mr. Fine, thank you. Next item is 5B, Office of Audit Services. Ms. Chapuis.
Good morning, Madam Chair and members of the committee. Belize Chapuis, Office of Audit Services. Agenda item 5B is an action item. Staff is requesting the Risk and Audit Committee to approve the Office of Audit Services proposed audit plan for the fiscal year 2022-23. As required by the internal auditing standards, the Office of Audit Services prepared a risk-based audit plan to determine the priorities of the internal audit activity for the next fiscal year. In conducting the risk assessment, the Office of Audit Services, as the third line of defense, coordinated its efforts with the second line of defense, the Enterprise Compliance Division, and Enterprise Risk Management Division. We interviewed CalPERS executive and senior management teams and sought input from the board members through surveys. Staff also incorporated information from prior audits. Office of Audit Services has 2 audit programs, internal audits and employer compliance reviews. In identifying the internal audit assignments and activities, staff evaluated multiple risk factors such as impact on the organization's strategic goals and financial statements, changes in operations and regulations, and internal controls. Office of Audit Services also allocated resources to consulting engagements and special projects. For the employer compliance reviews, the Office of Audit Services plans to complete 4 review cycles covering 1 compliance area per cycle. Using data analytics, staff will identify approximately 6 to 8 agencies for review for each cycle. As required by the internal auditing standards, we'll remain responsive to the changes in the organization's operations and programs, and we will review and update the audit plan as necessary. Any modifications to the audit plan will be communicated to the committee through the quarterly status reports. This concludes my presentation, and I'm happy to answer any questions.
Are there any questions for Ms. Chapuis? Seeing none, is there a motion to approve? Mr. Miller, second Mr. Pacheco. All those in favor, please say aye.
Aye.
Any opposed? Then, Ms. Chapuis, that is approved, and we now move on to 5C, which is the Independent Auditor's Annual Plan. And welcome, Mr. Kim and all.
Good afternoon, Madam Chair and members of the committee. Belize Chapuis, Office of Audit Service. Is it all? Oh. Agenda item 5C is an action item. Staff requests the Risk and Audit Committee to approve the board's independent auditor, BDO's audit plan for the audit of CalPERS' financial statements for the fiscal year ending June 30, 2022. The presentation is to provide the Risk and Audit Committee the opportunity to hear from the independent auditor regarding their approach, objectives, scope, and deliverables for the financial statement audit, and enable the committee to ask questions. BDO staff are presenting with me today, and I would like to turn it over to them.
Thank you. Well, good morning, Madam Chair, Vice Chair, and committee members. And nice to meet you for those that are new to the committee. My name is Billy Kim. I'm the overall BDO engagement partner leading the overall external audit of CalPERS. I'm joined here today with my colleagues, Sylvia Mack, as well as Topeka Nagin, who are both assurance directors at our firm, and they help lead the overall engagement team that we have in serving you. Now on the phone today, we also have Keith Hammond, who is our engagement quality reviewer, and he actually is the one that assists me in ensuring that we deliver a quality audit. Steve Franklin, who's our investments partner, typically joins us each time as well, but he's currently on vacation, so he's not here with us today. In terms of our presentation, we'll walk you through our PowerPoint presentation, and we'll specifically highlight key items for your attention. Now, if we can jump to slide 5, please. So slide 5, this includes the scope of our services. So it includes performing the audit over the overall financial statements of CalPERS for the June 30th, 2022 fiscal year end, and as well as performing the audits over the GASB 68, 75 employer allocation schedules, and issuing also an attestation report over the census data related to the California Agent Multiple Employer Defined Pension Plan. As part of our audit, as part of our overall audit of the financial statements of CalPERS, we will report to you the results of our work in November, and this is prior to issuance of these statements. At that same time, we will be sharing any internal control recommendations that we identify, and also communicate the remediation results of prior year findings as well. Next slide, please. Now, this slide is a reminder and provides the responsibilities of management as well as the Risk and Audit Committee. For instance, management is responsible for the preparation of the overall financial statements, including the fair presentation of its statements as well as its schedules in accordance with generally accepted accounting standards. And management is also responsible for ensuring that BDO is provided access to the records in order for us to complete our audit. Now, in terms of the Risk and Audit Committee, is responsible for the overall oversight and accountability of management over the financial reporting process. Next slide, please. Now, this slide covers the auditor's responsibility, and BDO is responsible to express a reasonable assurance opinion over the financial statements of CalPERS, including the schedules, in conformity with the generally accepted accounting principles, and also in performing our audit under the government auditing standards. Next slide, please. Now, this slide is on independence, and this is where we confirm with the committee that we are independent of CalPERS, which is a requirement under our professional standards. In addition, this slide also describes new independence requirements that are effective for fiscal year 2023, fiscal year end. So in other words, it's not this year's audit, but next year's audit. Now, we wanted to make sure we provide this update in advance because it will require us to have some additional considerations as we're assessing our independence of CalPERS. So for public employee retirement systems like CalPERS, affiliates need to be considered as part of our assessment of independence, and this includes any investments that CalPERS has and where CalPERS has control over these investments, which means ownership of over 50%. As well as any investments that where CalPERS has a significant influence over the investee, and that investment is significant to CalPERS as well. Now, we do not foresee any specific issues based upon our knowledge of the CalPERS current investment portfolio, but we are currently in the process of completing a preliminary check in advance of next year before this requirement is effective. Next slide, please. Next slide. Now, this slide demonstrates our overall audit timeline. And as you can see, our timeline spans essentially almost a full year. And so we are in touch with management throughout the year, making sure that there's no surprises throughout the process, that we're identifying any changes of information, adjusting any risks as necessary accordingly, and also providing any real-time updates on status with management on our progress. Now, currently, we're actually in our stages of wrapping up our planning as well as our interim testing this month. And so far, we've received great support from management and providing the requests that we need, as well as we have no findings to date that we have to report to you. But as I mentioned before, we will be reporting the full results of our audit of the financial statements of CalPERS in November during the November RAC meeting. So with that said, I will pass it off to Sylvia to go through the next few slides.
Thanks, Billy. So if we go to the next slide. Overall, our audit strategy is to assess the risk of material misstatement over the financial statements and schedules, whether due to fraud or error, as well as to design further audit procedures in response to those risks. An audit also includes evaluating the appropriateness of the accounting policies used, assessing the reasonableness of the significant accounting estimates made by management, as well as evaluating the overall presentation of the financial statements and schedules. In connection with our audit, we're also going to gain an understanding of the entity's internal controls. This is required to help us plan our audit procedures. However, we're not going to necessarily provide assurance concerning such internal controls. Additionally, governmental auditing standards require that we consider compliance with certain laws and regulations, which could have a direct material impact on the financial statements and schedules. However, our opinion is not necessarily, providing an opinion on that is not necessarily the objective of our audit. We will continue to update our risk assessment throughout the audit as well. If we go to the next slide, this summarizes our audit strategy considerations. Overall, our strategy is to focus on the higher risk areas and other areas of concern for management and those charged with governance. Our audit strategy includes consideration of the following. We'll consider the prior year audit results, as well as the preliminary analytical procedures that we perform, including discussions with management and those charged with governance. We're also going to assess the various inherent risks prior to evaluating the effectiveness of controls. There'll also be a continual assessment of materiality, both quantitative and qualitative considerations. We'll also consider recent developments within the industry, economic environment, and regulatory environment. We'll also consider recently issued accounting pronouncements and policies, as well as taking a closer look at the significant accounting estimates, areas that require judgment, or any significant unusual transactions. We'll also consider the control environment along with the information systems, if there's any service organizations that are used, and custodial banks as well. We'll also have discussions with the entity's internal auditors And then finally, we'll also use our specialists who are considered necessary to help assess any areas of significant risk and areas that may require specialized skills or knowledge. If we go to the next slide, audit planning is a collaborative and continuous process. And so as we go and progress through our planning as well as our audit, we will review and update our audit procedures where necessary to respond to additional risks that may arise. We will communicate any changes to the Risk and Audit Committee in a timely manner, as well as let you all know if there have been any changes to any significant risks that are identified. And with that, I'm going to turn it over to Deepika to go through the planned scope of our audit.
Thank you, Sylvia. Can we advance to the next slide, please? There we go. Thank you. All right. This slide includes our planned scope for the audit. It's based on our initial risk assessment, based on review of interim financial numbers, as well as meeting held with CalPERS personnel. One of the significant risk areas is the risk of fraud, including management override of controls. This is an area we are required to consider for all of our audits. For CalPERS, our response is going to include sending out third-party confirmations, reviewing any tip line activity, and performing risk-based testing, including journal entry testing. Another area of focus is related to the valuation of investments and related income. This includes a particular focus on investments that are based on estimates. We will be sending out confirmations to validate the holdings with respective third-party custodians for public, private equity, and real estate securities. We will also be using our valuation experts for harder-to-value investments to independently compare these values that are assessed by management. We will be testing gains and losses that have been realized during the fiscal year as well. Another significant estimate is the long-term care liability for future policy benefits for the long-term care fund. We are planning to use our actuarial specialists to assist us in reviewing the actuarial valuation reports, including the review of management's estimation methodology and any key assumptions used, such as the discount rate. Another area of focus is the estimated insurance claims due for the healthcare fund. This is a shorter-term liability. We will also utilize the assistance of our actuarial specialists to review the methodology and calculation of the liability. The next area of focus is pension and other post-retirement benefit liabilities and related disclosures. We will test the underlying census data for completeness and accuracy. We will use our in-house actuarial professionals to assist us in reviewing the pension valuation reports prepared by CalPERS actuaries. We will also perform recalculation procedures. Other areas of focus include planned contributions, benefit payments, and premium revenues. We will utilize a combination of sample testing along with analytical analyses to get comfortable over those amounts. And then finally, we will focus on information systems. As part of our planning process, we have been working to identify all of the systems that are relevant to the financial reporting process. For those systems, we will perform procedures in reviewing the internal controls, and this includes controls over cybersecurity. And with that, I'll pass it over to Billy to take us through the remainder of the presentation.
The last few slides that we have are provide some industry risk and resources that the firm has available to our clients, and so that includes public sector resources and thought leadership pieces as well, which are all available on our website. With that said, that concludes our prepared remarks, so if there's any specific questions, we're happy to address them.
Sounds good. Are there any questions for BDO? Billy and everyone, let me begin. Could you highlight any significant new issues or changes that you have identified in the audit plan this year from previous years?
Yes, one of the areas that has always been an area of focus is investment valuations. Now, given the volatility in the market, that is continuing to be an area of focus as well for this year. So that does include valuations of anything in which would include additional estimation analysis that would need to be looked at, and that would include any investments that existed within Russia, for instance, as an example. So those are some of the things that we are definitely taking into consideration, making sure that we have appropriate procedures to get comfortable over the valuation of such investments.
That sounds very important and critical. As you mentioned, it's a very volatile market. So what's your approach given that the volatility that's inherent in the market in making determinations that things have been properly valued?
Yes. So in terms of what we will be ensuring that we do, it's going to be very important for us to have as much information independently, also in terms of what is as of 6/30 year end. And so management does have a process where they preliminarily value their investments using some interim information until the 6/30 information actually comes available prior to issuance. And so we'll be making sure that we wait for that information to make sure that the appropriate values are assessed and considered for recording. On top of that, we use our own independent specialists. So for instance, there are certain investments that are not there's not as much market information, for instance. And so we have valuation specialists that assist us in independently assessing values and reviewing valuation reports that are received from CalPERS as well. So that includes real asset type investments as well, and other private equity type investments.
All right, thank you. This is coming on to a time that's going to be pretty intense for you and for everyone. Are there any resources that you need from staff or from the board that you're not receiving?
No, not at this point. We've received great cooperation thus far. We are hoping that would continue to be the case for the rest of the audit. And so we will be commencing our year-end fieldwork in mid-August. And so at that point in time, it'll get pretty busy for us.
Yep. Again, Mr. Pacheco, thank you. I don't have you. You need to make a request.
I did.
It's not showing up. Okay.
It's green.
Oh, there you go.
There we go, microphones.
There we are.
Double click. There it is. Thank you. Sorry for the technical difficulties there. Thank you very much for the presentation. My question is back on the scope of work, specifically the information systems and the in terms of evaluating the system for financial reporting. And my question is about the cybersecurity controls and what are the process or the systems that you're going to be evaluating with respect to that? You know, given all the things that have been going on in the world with cybersecurity, malware, ransomware, what are your approach in that respect? Thank you.
No, thank you for bringing that up. That is something where we are considering looking at even deeper this year, just given what's going on in the world as well. And so we look at it from the lens of how it potentially can impact the financial reporting process. Mm-hmm. And so as part of that, we end up, what we're going to be doing is we're going to be utilizing our cybersecurity experts to assist us to perform walkthroughs of understanding the controls that exist in that arena, and just to see any specific connections or potential gaps that might exist in terms of it impacting the financial reporting process. And so, as it relates to this, it's a little unknown in terms of from a CalPERS perspective. We've always looked at it. It's been something that we've always considered, but this year we wanted to make sure that we're also specifically bringing in specific experts in place to really assist us to go a little bit deeper from an understanding and risk assessment process.
Well, thank you very much for that. That's just, I believe that's really important these days, especially with the war in Ukraine and the Russia attacks and so forth. So thank you. Appreciate that. Bye-bye. Thanks.
Are there any other questions? Mr. Rubalcava.
Thank you. I also have a question on the scope of work on the pension and OPEB related disclosures. In your presentation, you mentioned you have, well, the scope of work says you have internal actuaries, but you also mentioned you have external experts. So the way it's laid out here, you're going to use a sample census and to confirm the reasonableness of assumptions. Does that mean you do, well, you look at we just had an experience study, so do you look at the reasonableness of the demographic assumptions that works? Two questions, that we accepted, demographic assumptions, for example, because you did mention the discount rate. And second, do you do a parallel actuarial, or how do you test it? I mean, is there, because I know some systems, they hire somebody to do an audit. The way they do an audit is they duplicate the actuary. But are you going to do that too, or is it more like, well, just explain it, I guess, is what is the work that's going to be done? Thank you.
Sure. Thank you for the question. Yeah, so we have internal pension actuaries within the firm. And so as part of our audit, what they will be doing is assisting us in understanding the methodology that CalPERS has used in putting together the evaluations that drives what is ultimately recorded and also disclosed from a pension perspective. And so what that entails is reviewing the methodology, reviewing the assumptions, and then also specifically running within our own models to see if it makes sense as well. So there's, in some degree, there's an independent parallel analysis that goes on from an auditing perspective. At the same time, there's the experience study would be something that we definitely take a look at as well. And then on top of that, if there's any other parallel reviews that take place by the organization, then we'll take a look at that as well to see if we're getting around the same ballpark in terms of estimation.
Thank you.
Yeah. And Mr. Rubalcava, we do have an actuarial auditor, Buck Consulting, who comes and reports out to the committee.
Thank you. That's what I was getting to.
Yep.
Okay, thank you.
I don't see any other questions. Are there any others? This then is an action item. If I could get a motion to approve. Mr. Pacheco, second by Mr. Miller. All those in favor, please say aye. Aye. Any opposed? Any abstentions? The item is passed, and thank you for your work. We will now move on to information agenda item 6A, annual compliance report. Mr. Fine.
Thank you, Madam Chair. Again, Kevin Fine, CalPERS team member and Chief Compliance Officer. In this item, we are submitting the annual compliance report for fiscal year 2021-22. Obviously, as the name implies, you're provided this report every year. The full report may be found as an attachment number 1 to agenda item 6A. Before I get started, I would like to point out that on page 5 of the report, under the first bullet titled Form 700 Highlights, the very first bullet should read 2022 instead of 2021. No matter how many times you edit, sometimes a few slip through. The report highlights and provides detail regarding the compliance and risk management activities that have occurred throughout the enterprise over the past fiscal year. The integrated assurance model incorporates compliance, risk management, and governance practices as a multifaceted approach to promote compliance awareness and accountability. I will highlight just a few of the compliance and risk activities. We obtained 100% compliance for all active filers for the 2022 annual Form 700 filing season. We conducted an enhanced Form 700 review for 100% of all CalPERS Form 700 filers, which included a 2 to 5 year comparison of Form 700s for each filer and a review of financial interests where available, resulting in a review of approximately 3,000 Form 700s. And you heard some about that in the February committee meeting. Also, just for your information, we are currently undertaking another 100% review of this fiscal year's filings as well. We developed conflict of interest guidance for covered persons and Form 700 filers, including examples applicable to CalPERS. We partner with the Customer Experience Division to facilitate an outside consultant delivery of 5 live fraud awareness training events for our contact center agents to focus on the latest fraud trends in the industry, social engineering tactics, and methods to identify and counter fraud schemes. As in previous years, the balance of the report contains highlights from each branch across the enterprise as to their compliance and risk work and initiatives as well. Thank you. That concludes my remarks. I'm happy to answer any questions.
Are there any questions for Mr. Fine? Well, let me just add that I've been very pleased and impressed with the method that you're using in stepping into this role and looking forward to the reports that are produced.
Thank you, Madam Chair. I'm enjoying working with you all as well and look forward to continuing on for many years to come.
All right. This was a information item. Item 6B is summary of committee direction.
Madam Chair, I took no note of any direction.
Nor did I. And with that, we will move to item 6C, public comment. There is no further public comment. Then that will bring us to the temporary conclusion of the open session. We will now recess into closed session for items 1 through 3 of the closed session. The open session of the Risk and Audit Committee meeting will reconvene immediately following this closed session, and I thank everyone for your attendance. We will be beginning with Mr. Fine, and then we'll move on to Mr. Pui. Thank you. Committee meeting. The next Risk and Audit Committee meeting will be held in November, and we will resume the Pension and Health Committee open session at 1 p.m. Thank you.
We're going to reconvene the Pension and Health Committee. The first item on the agenda will be item 2, the executive report. Who's going first? Mr. Sweeney?
Yes, please.
Yes, sir.
Good afternoon, Mr. Chair, members of the committee. I'm Anthony Sweeney, CalPERS team member, and thankful for being here again in person with you today. Our regional offices have now been open for a few months, providing in-person and virtual services. And in May, we had one of our busier counseling periods with just over 6,300 members counseled, which is about a 35% increase of prior to our openings. Our members are hearing our strong recommendation to make appointments to ensure that they are served timely and with the most efficiency. And 80% of our members have been making appointments in our offices. The remaining 20% are walk-ins, and we're able to triage them and provide the service options that would be available to them. Roughly 60% of our appointments are being conducted virtually, and 40% of those are occurring in person. We also hosted 40 member education classes in May with a total attendance of about 1,500 members. We just started in-person member education classes, so 5 of those 40 classes were in person. Moving to CalPERS benefit education events, registration is now open for our upcoming virtual CB that's occurring on June 22nd and 23rd. So far, we have over 2,700 members that have been registered. And following this June virtual event, we will be reintroducing our in-person CBs with the event at the Oakland Marriott on August 26th and 27th. We always welcome board members to join those events, so we hope to see you in attendance then. I wanted to provide a brief update on the limited duration regulations that you approved to move forward at our April committee meeting. The regulation package has made its way to the Office of Administrative Law to begin the rulemaking process. They will be published on June 17th, and the comment period will run through August the 1st. The whole process, including the public notice, hearings, comment periods, et cetera, can be rather lengthy, and we would anticipate an updated version after comments are received. We'll likely make it back to you for further review and approval later this year. If everything stays on track, ultimate approval will occur in spring or summer of 2023, and then regulations are published on a quarterly basis, meaning the effective date would eventually be summer or fall of 2023. This concludes my update, and I'm happy to take any questions.
Seeing none, thank you.
Thank you.
Mr. Molds.
Great. Good afternoon, Mr. Chair, members of the committee. Don Molds, Chief Health Director. Before we get to the focus for today, which is 2023 health plan rates, I want to give you a couple of updates. First, this summer, we'll have completed 2 successful cohorts of the CalPERS Healthcare Academy. Last summer, I announced the launch of the Academy, which is an internal program we created for CalPERS team members to become more informed about healthcare markets, policy, and the role of purchasers. Marion Mulkey, who delivered the health education session to the board in 2021, has worked closely with us to develop the curriculum and has led both groups. It's proven to be an excellent professional development opportunity for the nearly 45 team members who have gone through the program, and the health program has benefited greatly. Cohort teams research and present on a healthcare topic relevant to CalPERS, which include recommendations for our consideration. In many instances, we're taking these terrific recommendations and they're becoming part of work groups we've created around our strategic plan and serving our members. The Academy is a big success, and we plan to offer 2 more cohorts to further expand healthcare knowledge throughout the enterprise. Next, I want you to know that this summer we're rolling out new functionality in My CalPERS. Active employees, with their employer's approval, will be able to make any of their health enrollment changes online themselves in their My CalPERS account. Retirees have been able to do this for several years now. It's a great example of how we're looking to increase efficiency and streamline the enrollment process for those members who choose to use it. I want to set the stage for the preliminary premiums you'll see presented today. We've been working hard along with our plans to better serve our members by adding more cost-effective health plan choices and benefit designs focused on bringing our members high-quality, equitable care. Based on the changes you approved in November, members living in every county throughout the state will have much better options. No longer will the PPO plans be the only option in some of our rural areas. For the first time, members in those areas will have the option to switch to an HMO or an exclusive provider organization, an EPO plan that offers lower cost sharing and in some cases a lower monthly premium. Our members living in Monterey County will have the added choice of a low-cost HMO option. We've added more Medicare Advantage plans in 2022 to increase choice in plan competition, and this year we're seeing a third year of Medicare Advantage premium decreases as we benefit from the cost efficiencies of those plans. Our HMO plans are also performing well in what's shaping up to be a very difficult year for health premiums nationally. All that said, this will be a hard conversation today. The rates we're bringing you are unsustainably high. Our discussion will make it clear exactly where our foci will need to be going forward. We face big challenges in our PPO basic portfolio, both with the rate increases you'll see today and the deficit in the PPO basic healthcare fund. Once Ms. Mom is done walking you through the 2023 preliminary rates, I'll be back to talk more about both and to lay out our plan for addressing them going forward. That concludes my remarks, and I'm happy to take any questions.
Thank you. Ms. Taylor.
Yes, thank you, Mr. Chair. Sorry, Mr. Moltz, just a really quick question. You went over it, I'm writing, and I couldn't keep up. So you said that my CalPERS, you'll be able to make changes to the healthcare online? Is that what you said?
To healthcare, yes. You'll basically be able to make your elections and to make changes.
And when's that happening?
This summer, so it will be in effect for open enrollment in the coming year. For the fall for 2023.
Oh, it will be ready for this year. So correct. You don't have to go do all of that through your employer like you used to have to do.
That's correct. We need an employer buy-in also.
Okay.
But we're assuming that for the most part that will be happening.
Cool.
Yeah.
That makes me very excited.
Yeah.
Thank you very much.
All right, thank you. So you know the requests. We'll move on to item 3, action consent items, the approval of the April 18th meeting minutes and the June 14th meeting minutes. What's the pleasure of the committee? Moved by Taylor, seconded by Miller. Any discussion on the motion? Seeing none, all in favor say aye. Aye. Opposed, no. Motion carries. Item 4, the information consent items. Having no request to move anything off of that agenda item, moving on to 5, information agenda items 5A, preliminary 2023 HMO and PPO health plan premiums. Ms. Malm.
Good afternoon, Mr. Chair, members of the committee. Kim Malm, CalPERS team member. This is an information item to present the 2023 preliminary health plan premiums. On the agenda today, I'll go over program updates and the preliminary weighted averages. I'll also go over the proposed preliminary premiums for each of the basic and Medicare plans and the next steps. Let's review the program updates for 2023 that you approved last November. In addition, I think that it's important to note that this year we made a modification to the rates development process where we required the health plans to sign and send in an actual attestation with their submission. First, Kaiser is bringing in a new Medicare Advantage plan named Summit. It's a $0 copay plan and will be in addition to Kaiser's existing Senior Advantage plan. Kaiser is also adding a quarterly $70 over-the-counter allowance for both their existing Kaiser Senior Advantage plan and the Summit plan. Finally, due to extenuating provider negotiations, Kaiser is not moving forward with its expansion into Monterey County for 2023, but hopes to do so for 2024. In the basic portfolio, Blue Shield is expanding their Access Plus EPO into 11 rural counties and expanding their Trio product into 7 counties. We're particularly excited to announce that amongst those 7 new expansions is Monterey County. Having Trio in Monterey will mean that our members will finally have a low-cost HMO option. Blue Shield is also adding a pharmacy shared patient savings program for their Trio members. Western Health MyCare Select Medicare Advantage Plan is adding a post-discharge meal benefit following a hospital stay. Anthem Medicare Preferred is reducing copays for acupuncture and chiropractic services to $10 to match the current Medicare-covered copays for these services. Again in November, the board approved benefit design proposals that apply to all of our basic plans, which include changes that make the reproductive health and fertility benefits more equitable, enhanced coverage for hearing aid members, for members aged 26 and under, and a primary care physician match for PPO basic members. Next, let me briefly mention that this is the last of a 2-year phase-in implementation for risk mitigation. In 2022, premiums were adjusted 50%. The 2023 premiums reflect the full impact of risk mitigation. And with its full implementation, we anticipate smoother and more predictable changes across the portfolio in future years. And just a reminder, Medicare plans are not included in the CalPERS risk mitigation strategy. Lastly, the healthcare fund is currently below recommended reserve levels because of losses from the 2 PPO basic products in 2021. So we don't recommend the use of healthcare funds to buy down premiums for 2023. For the timeline, today I am presenting the 2023 preliminary premiums, which include the new program changes I just mentioned. Between now and July, the CalPERS team will finalize these premiums, and the board will then approve them at the July board offsite. So let's look at the weighted averages for HMO, PPO, and Medicare. The first slide shows the overall basic HMO increase at 4.42%. If you remove the 2022 snapback, which is really how we should look at premium increases, it is a 3.7% increase. This is very low compared to the industry. I'll go over the healthcare trend chart a little later that compares our increases to the market. And just as a reminder, the numbers you see here and throughout the presentation are all single-party premiums. The regional premiums for contracting agencies are included in attachments 2A and 2B. The PPO basic plans, PERS Gold and PERS Platinum, have a 15.76% overall premium increase. Clearly, these are unsustainable high-rate increases. Don and I will discuss the PPO in more detail later in this presentation. The Medicare Advantage plans have an average overall premium decrease of 3.23%. This is the 3rd year we're seeing an overall decrease in Medicare Advantage plan premiums. The Medicare supplement plans have an overall weighted premium increase of 9.83%. Most of the 2023 increase is due to the high pharmacy costs we are seeing for the Medicare supplement products, as well as the 4.45% snapback from the 2022 premium buy-down. And finally, as I mentioned already, the overall combined HMO and PPO preliminary premiums have a 6.8% increase for 2023. Let me speak to some of the cost influencers that are impacting healthcare costs in our program. First, medical inflation continues to impact premiums. General medical inflation includes the annual increases in payments to hospitals, doctors, and other healthcare providers. Medical inflation is contributing about 4% of the 6.8% increase for 2023. COVID-related costs, including treatment, were more than doubled in 2021 than in 2020. The 2023 premiums submitted by the plans utilize the 2021 experience and the first few months of 2022. Both the HMO and PPO experienced a similar pattern for COVID. Many plans expect that COVID testing will increase slightly in 22 and 23, while treatment costs are expected to decline as prevention and treatment of COVID continue to improve. The assumption that COVID costs will stabilize in 2023 and will not result in additional increases. We aren't saying that COVID is going away, just that we don't expect it to keep causing premium increases. Pharmacy costs continue to increase, driven primarily by increased utilization of high-cost specialty drugs. The new Optum contract with improved pricing and rebate guarantees has brought the projected 2023 pharmacy increase from double digits to a very low single digits. Overall, the Optum pharmacy increases have a very modest 3% increase to the 2023 Medicare premiums and a minimal impact to basic premiums. Lastly, in the 2022 premium development, CalPERS spent approximately $125 million of the healthcare fund surplus to buy down premiums for multiple basic and Medicare plans in both HMO and PPO programs. The snapback of the 2022 premium buy-downs is contributing about 1.4% to the total increase. As I mentioned previously, I'd like to share with you Oliver Wyman's healthcare premium trend benchmark for January 2022. We use this to compare how CalPERS premiums are doing relative to the rest of the market. As you can see, CalPERS basic HMO and Medicare Advantage came in lower than the national benchmark. Yet the overall program increase of 6.8 is comparable to the national benchmark, and that's because the CalPERS PPO trend is higher than the national benchmarks. It's worth pointing out here that the basic PPO increase without the snapback and premium surcharge is 10.48%, about 3% higher than the benchmark. Medicare supplement plans premium increase without snapback is 5.38%, which is close to the benchmark of 5.20%. Don will talk about the challenges facing the PPOs later in this presentation. He'll also address the healthcare fund deficit presented in April by the actuarial team to the Finance and Administration Committee. Now I'm going to walk through each basic plan, starting with the HMO plans. As a reminder, this again is the second and final year of risk mitigation implementation. We make these adjustments in the basic plans to price them based on the value of the benefit design and network, rather than the concentration of healthy or unhealthy lives in the plans. Also, I'm happy to report in 2023, we'll have an HMO or EPO option for all counties, as Don mentioned in his opening comments. Let's start with Anthem Select HMO. Anthem Select has a strong presence in the Bay and Central Valley. I'm going to step you through each of the charts on this first plan. I will point out more highlights on the following pages after I describe what each of these charts mean. The table shows the final published 2022 premium of $848.08. The plan's preliminary 2023 premium of $882.62. This is before risk mitigation. Next is the plan's risk score and risk mitigation impact for the plan. So for Anthem Select has a risk score of 0.9838. This indicates the plan is healthier than average members in the basic portfolio. Now their premium is $903.85, a 6.58% increase over 2022. Looking at the cost drivers chart to the right, the 2023 premium increase for Anthem Select is due to several factors, including medical cost increases, which contributed 4.47% to their premium. The next bar is pharmacy, where we see a slight reduction. The other bar is the family factor, which accounts for changes in the average family size during open enrollment. It also captures some of Anthem's administrative costs. There's a 2.48% snapback impact from using the healthcare fund reserve to buy down the premium by $10 million in 2022. And then the last bar on the chart is the impact that risk mitigation had on their rate. As you can see, overall, the premium increase is 6.58%. Now let's look at Anthem Traditional. This is a broad network HMO and is offered in many high-cost, low-competition areas of the state. Anthem Traditional has a premium decrease of $217.68, which is almost entirely due to risk mitigation. The risk score is 1.2121, which means they have more unhealthy lives than the average basic plan. So risk mitigation helps their premium significantly. Overall, Traditional's 2023 rate is 6.8% lower than it was in 2022. You'll also note here that there's a 5.78% snapback from buying down the premium by $10 million in 2022. Next is Blue Shield Access Plus, which is also a broad network. In the last couple of years, they've been working with us to help achieve our goal of having an HMO or EPO option available in every county. Here you'll see a premium decrease of $245.92 due to risk mitigation. This brings the 2023 premium to $842.61, a decrease of 6.4% from 2022. Blue Shield is a narrow network, TRIO, is a narrow network plan introduced in 2020. TRIO's preliminary premium is 2.58% increase over 2022. As TRIO was introduced 3 years ago, it is a relatively small plan. They don't have much experience to base their projections. Looking at the cost drivers chart, there's a 1.25% snapback from buying down the premium by $1.7 million in 2022. Risk mitigation increased TRIO's premium by 3.34%. I'd like to add here that in 2023, we're moving forward with TRIO's expansion into Monterey County, along with 6 other counties. That's a very nice win for CalPERS members in Monterey, and as you can see, we're able to successfully expand to Monterey without a big increase to their premium, which is another critical success. HealthNet Saluti Mas is another narrow network plan that provides services in the lowest cost Southern California counties. The plan has the healthiest lives in our portfolio with risk mitigation. Their premium is now $631.89, an increase of 29.88%. Even with this high premium increase, Saluti Mas has the lowest HMO premium in the basic portfolio, actually $90 less than the next one closest to it. Looking at the cost drivers chart, the increase is primarily driven by 8.54% snapback from buying down the premium in 2022, and again, from the 16.84% impact of risk mitigation. HealthNet SmartCare operates in 20 counties, but nonetheless has a very small number of members. HealthNet SmartCare's premium is $993.39, or a 1.36% premium reduction from 2022. SmartCare's experienced volatile member migration and risk concentration fluctuations in the last few years, which impacted their medical and pharmacy numbers. However, risk mitigation helped SmartCare by over 8%. Kaiser is a closed network that operates in 31 counties throughout the state. Kaiser's 2023 premium is $852.68. Looking at the cost drivers, they have an 8.04% impact from medical. The 2-year phase-in of risk mitigation increased Kaiser's premium by 2.74%. Without it, Kaiser's increase would be 3.2%. Sharp is a closed network that provides services in the San Diego area. This is a small and healthier plan. Their 2023 premium is $764.96, or 9.4% higher than 2022. Most of that is due to risk mitigation. United Healthcare Alliance is an HMO plan operating in 26 counties. They have a slightly sicker population, so risk mitigation reduces the plan's preliminary premium slightly to $848.53. There's a 2.79% snapback from buying down the premium by $16.7 million in 2022. That and their medical trend accounts for most of Alliance's 3.73% premium increase. United Healthcare Harmony is a narrow network HMO available in 5 Southern California counties. UHC's Harmony's premium is a 2.04% decrease over 2022 with a premium of $722.28. The decrease is mostly due to pharmacy and updated risk mitigation assumptions. One more thing to note is that Harmony's premium is coming in over $130 lower than Kaiser's. As you know, one of the reasons you propose adding Harmony last year was to introduce another low-cost plan that could put downward price pressure on Kaiser. Western Health Advantage HMO provides service in Sacramento and select Northern California counties. Their preliminary premium is $760.17, an increase of 2.55% over the 2022 premium. Moving on to the PPO plans, PPO basic plans. As I mentioned earlier, the PPO program is experiencing significant premium increases, far higher than the HMO program. PPOs lack the care management that are central in our HMOs. Members have the freedom of choosing any providers for care and see specialists without a referral. This results in higher utilization of services. PPO utilization is almost 40% higher than HMO utilization. The capitation payment system is heavily used in our HMOs and creates incentives for healthcare providers to manage care. This results in a more cost-efficient healthcare, lower unit costs for inpatient, emergency room, and physician services, and more appropriate utilization. In addition to having higher trends in all of these areas, our PPO plans cover out-of-network services, which cost much more than in-network care. The basic PPO plans had a very difficult year in 2021. COVID-related costs came in more than double than 2020 COVID costs. We also saw a strong increase of non-COVID services as our PPO members started seeking care that they had deferred in 2020. Looking at the cost drivers chart, the main drivers are the medical trend and the increase in pharmacy costs, which total about 6.88% to the premium increase. PERS Gold had a very large increase due to high utilization and costs. The medical cost in 2021 was 21% higher than 2020. For PERS Platinum last year, we spent approximately $50 million of surplus reserves to buy down that 2022 premium. The snapback of the buy down contributed 2.66% to the total PPO premium increase. I'll note here that the PPO basic plan premiums include surcharges, 2% for Platinum and 3% for Gold. These are necessary to start replenishing the healthcare fund. There are no surcharges in the Medicare Supplement PPO plans, Gold or Platinum, since they do not have a deficit and therefore don't need to replenish the reserve. Don will talk at the end of this presentation about challenges facing the PPO products and how we propose to address them. Here we show the 2023 preliminary premium levels for each of the basic plans together as a portfolio. As you can see, there's still a variation in price points. Okay, moving on. Now I'll go through each of the Medicare Advantage and Medicare Supplement plans. Anthem Medicare Preferred is a statewide plan with a small enrollment. Anthem Medicare Preferred has a $413.59 premium, a 14.83% increase over 2022. Looking at the cost drivers, medical is within reasonable range. The majority of the increase is due to the 2022 snapback of almost 10% from last year's buy down of $1.8 million. As a reminder, Medicare plans are not included in CalPERS risk mitigation. Blue Shield Medicare is a new Medicare Advantage plan in 2022 with 591 lives. They have a $361.90 premium with 2.49% increase over 2022. Kaiser Senior Advantage has a $283.25 premium, a 6.37% decrease from 2022. Kaiser is showing a medical increase for 2023. They also administer their own pharmacy and are showing a pharmacy decrease. Kaiser Senior Advantage Summit is a new plan that offers a $0 copay for most services. This plan has a preliminary premium of $336.29. The roughly $53 premium difference between the existing Senior Advantage product and this new product is the copay reduction. This plan has a copay for emergency room, pharmacy, acupuncture, and chiropractic visits. Summit is not available out of state. Sharp Direct Advantage is proposing a $249.79 premium, a 5.33% decrease. This product was introduced in 2021 and has 170 lives. United Healthcare Group's Medicare Advantage has a $299.68 premium, an increase of 1.7%. On the cost driver chart, the reduction in medical is due to an increase in the CMS revenue. UHC Medicare Advantage self-administers their pharmacy. Their pharmacy trend contributed 3.89% to the premium increase. UHC Medicare Advantage Edge has a $357.50 premium, a 3.02% increase. UHC Edge is new in 2022. Again, like many of these new plans, they face volatility for the first few years because there's no experience to project costs. Western Health Advantage has a $331.11 premium, an increase of 5.13%. MyCare Select is another new plan for 2022. It's also a very small plan with 57 lives, and so again, it's difficult to project costs. After the transition from 3 to 2 PPO Medicare supplement plans, the majority of the PPO Medicare members are concentrated in the PERS Platinum plan. The PERS Gold PPO Medicare has an increase of 4.05%. PERS Platinum has an increase of 9.97%. Overall, the 2023 increase is mainly due to high pharmacy increase and the snapback from the 2022 buy-down. Last year, we spent $23.8 million to buy down PERS Platinum Medicare supplement premium. In addition, we spent $3.7 million to buy down the PERS Gold supplement. For 2023, there's roughly $27 difference in premiums between these two plans. And again, as I stated earlier, there's no surcharges for Medicare Supplement, PPO, Gold, or Platinum. The benefits for these plans are similar, and they both have the same network. PERS Platinum Supplement has slightly richer benefits for hearing aids and skilled nursing. It's also available out of state, where PERS Gold Medicare Supplement is not. Here you'll see the 2023 Medicare premiums, which range from $250 to $420. For next steps, the CalPERS team will finalize the premium amounts. In July, we'll present you final premiums for board approval. The 2023 health premiums will be effective on January 1st, 2023, and this concludes my portion of the presentation. I'd like to thank the rate teams for their lot of hard work, Actuarial Office, Public Affairs, and the health team. And I'm going to now turn it over to Dawn, who's going to discuss challenges facing our PPO products.
Mr. Chair, you want to take a break and take questions, or should we go in and take questions after?
That's up to you. How do you want to do it?
I've kept this a little shorter, so why don't we do it that way, and then we can go into questions. So as Kim mentioned, the challenges we're seeing, microphone okay? Okay, great. As Kim mentioned, the challenges we're seeing with the rates this year are almost entirely driven by our PPO products, by our two basic PPO products in particular. Increases in our HMO rates and our other managed products are much more modest. When we take snapback out of our HMO rate, which as Kim mentioned is the right way of looking at actual premium inflation, it drops from 4.42% to right around 3.7%. That's about half of the projected national average for premium inflation. And as Kim noted, our Medicare Advantage products are getting cheaper again this year. The investments that you've made in some of the narrow network products, Trio and Harmony, but also Western Health Advantage, Sharp, and Saluti Moss are also starting to pay dividends. The same seems to be true of our new MA products, which are creating positive competitive dynamics in our Medicare market. Our drug spending is also coming in line for 2023. For Medicare, pharmaceutical inflation is running a very modest 3%, and for the basic program, it's basically flat. The PPO is obviously a very different story. As Kim said, the rate increases we've seen over the last few years, and this year in particular, are unsustainable. We're particularly focused on the PERS Gold product, which for 2023 will still be among the lower cost plans, but going forward will not be if we don't take decisive action in the coming year. The other big challenge facing the PPO is the one that we talked about with you in April. We ran a large deficit for 2021 caused by a confluence of much higher than anticipated medical costs, which were primarily COVID related, higher than expected drug costs, and investment losses. The steps we're going to need to take with respect to the PPO involve both near-term and longer-term interventions. What I'd like to do is walk you through those. With the 2023 rates, our goal is generating enough premium revenue to start replenishing our HCF reserves and adequately fund our 2023 outlays for the two PERS PPO products. As we've talked about, it's essential that we set rates high enough to do these things because the HCF fund is critically low and we always need enough money in that account to pay our bills. When we briefed you back in April, I talked about a few different options that we were planning on exploring that could help address some of the challenges facing our PPO products. One was stop-loss insurance, which we were hopeful could help mitigate some of the risk we were we to see large medical losses in the future. Another was conversion of our PPO to a fully insured product or to a flex-funded product like most of our HMOs. Both were also attractive because having them in place would have dramatically reduced our reserving requirements. Unfortunately, our analysis is that neither of those is a good option for us. Our near-term strategy for addressing the challenges facing the basic PPO are embedded in the premiums we are bringing you today, which are neither conservative nor aggressive. They're priced at exactly what we anticipate will be our costs. In developing them, we worked with both Anthem and our outside consultant, Milliman. However, on top of the premiums, we have included a surcharge, which we propose having in place for 5 years. That allows us to slowly build up our reserves over that period of time until they are fully replenished in 2027. The surcharge is roughly 2%, is roughly 3% of PERS Gold premium and 2% of PERS Platinum. The hope is that once the costs stabilize, we may be able to drop the surcharge sooner. We modeled a lot of different options before landing on the 5-year replenishment strategy, and our analysis leads us to believe that it's the best option. On the one hand, we need to start replenishing the reserves as quickly as possible, and ideally we'd like to be back to full reserves in a period of time shorter than the 5-year schedule we're proposing today. However, we don't want to raise premiums more than we absolutely have to, and we also need to be careful when we raise premiums for PERS Gold in particular, because if we raise them too much, we're going to see attrition. In modeling various scenarios, our actuaries have projected that the current premiums, including the surcharge, will result in attrition numbers that are on the high for the normal range of members who leave in any given year, but not high enough to have additional material impact on our premium. Other shorter time frames for replenishment likely would cause an additional material impact on premium. As I said, the other critical task is curbing cost growth going forward. Our plan in the coming months is to develop benefit design options that we will be bringing you in September, and then again for potential adoption in November. During this period, we'll also engage stakeholders. The overall goal is going to be to keep PERS Platinum as affordable as possible and to keep PERS Gold in line with the costs we see in our low-cost HMO products like Trio and Harmony. In addition to the intense work on rates over the last few months, we've been reaching out to national groups with deep expertise in this space. As always, our aim is going to be to bring you options that connect our members with high-value services and that minimize cost shifting. That concludes my comments about the challenges facing the PPO and gives you a picture of our plans for addressing them. I'm sure you have questions, which we're happy to address now.
Thank you, Mr. Molds and Ms. Mom. I first want to start off by thanking you and your team, the whole team that worked on this year. It's never an easy process. We understand that. But I think you've done a yeoman's job in getting us to where we are, and I want to thank each and every one of you and your team for all the dedicated hard work. At the same time, I also need to say, since last year at this time I did call out United for needing to have sharper pencils. At the same time, I think I also need to recognize the fact that they did sharpen their pencils. And they heard what we had to say last year, and they came back with a better price. I always just, all of the funds came back with better prices. But that being said, they did a good job, and I want to recognize that. Puts them below Kaiser. I think Kaiser needs to get back to work. So at this point, I'm going to call on Ms. Taylor.
Yes, thank you, Mr. Chair. And thank you, Kim and Don, for the presentation. As always, you guys do such a job to make sure you get us to the best rates we can get to. I will echo what Chair Fackner just said, which is we got United to listen to us, and maybe next year we can get Kaiser to listen to us a little better. They did a little better, I will say, but it always can be better. And I just want to repeat some of the stuff that I had talked about earlier. For one thing I want to make sure is why we don't. So Ms. Malm, could you, for our members, answer why we don't include the Medicare Advantage programs in the risk adjustment?
Medicare is already risk adjusted by Medicare. Yes.
Thank you. I just wanted that addressed in public. And I just wanted to kind of go back on the risk mitigation. We're in the final year, right? So this will be the last time we see this large risk adjustment one way or the other, correct?
That's correct.
Okay, and then the snapback, we're not doing any of the buybacks right now, so...
We will not see snapback next year.
Right, and so this will be kind of a whew for next year.
Yeah, I mean, it's not for great reasons, obviously.
Right.
But it will be, it will not be part of the equation next year because we're not anticipating buying back premiums.
Okay, and I'm not sure, but I just feel like maybe we shouldn't be doing that if that's going to cause us this kind of contention.
And I will say that when we come to you with to begin the discussion about the 5-year HMO procurement, whether flex funding as we do it, or just period, is one of the things that we're going to want to be talking about.
Great. Yes, because it seemed like it was a little bit. Every time we do that, right, we buy down those rates, we feel like, okay, pat ourselves on the back because we got those rates down, but now we see the result of that, right?
Yeah, so they do increase volatility year over year, as we've talked about in the past. When you buy back premiums, you artificially lower the base, which is a good thing.
Right.
But then in the coming year, unless you buy back at least as much, you see snapback in the rates, the rate increase is artificially higher.
Right. Which, makes it harder for all of us. And then I wanted to talk about one of our low-cost plans. As my members look at these kind of plans, I want to make sure I'm on the right page here. I think it's Harmony. And let me get there. Hold on. Yeah. So it is... Oh, I'm sorry. It's HealthNet Salud y Mas. And I just wanted to mention that while the cost drivers of this increase, of this almost 30% increase, I understand are the risk mitigation, the main cost drivers, the risk mitigation and the snapback. I just want to remind everybody, hopefully that's it, because this is one of our low-cost plans for folks in the area that this plan serves, and having a $200 increase is huge for these folks. So I just want to make sure that that is not an ongoing problem that we see in the future. And then also, we had some medical costs, and if you guys could go a little more deeper into some of those, not just for health, not for that particular one, but for a lot of our plans, we had high medical costs. And I know that you guys had explained some of the reasons for that. If you guys would go into that a little bit. High medical costs on most of our plans where there were rate increases.
Yeah, do you want to jump in, or?
That was, I think, earlier in my presentation talking about the COVID impacts that we saw, and then we saw that the members came back and did non-COVID activities, or I'm sorry, like non-necessary.
I know what you're talking about.
I'm saying it wrong. But non-COVID related medical expenses, such as knee, hip surgeries, and after the 2020 surge. So the increases for this next year show COVID and non-COVID services.
And then the year before, the increase with COVID had to do with no services except for
and COVID. Yes, and the alpha of COVID that Don.
Yeah, we saw in 2020. We saw certainly saw COVID costs, but we saw an associated decrease in the use of normal medical care. So part of that was the cancellation of elective surgeries to make space in hospitals for people with COVID. Part of that was apprehension on the part of our members to get medical care. We saw, as we've talked about in the past, pretty dramatic increase in the use of telehealth, which in the early days, and I think still to a certain extent, does a nice job of replacing in some instances and not such a great job in others, as we are talking on an ongoing basis about how to lean into and take advantage of telehealth. We're parsing a lot of that out. But in 2021, which is the most important year for this rate buildup, when we build up rates, we look at the last full year primarily. That was 2021. We had two COVID surges, Delta and then the first part of Omicron. And then the second thing that happened was we had people returning in much higher numbers. That was unanticipated by the actuarial community. So in Alpha, as I said, with an increase in COVID treatment, there was a corresponding decrease in normal care. Hospitals became much more sophisticated at being able to treat people without COVID and not to have to cancel elective surgeries. People were coming back after a year of living with COVID. They needed to get preventative care. Their tolerance for the risk associated was higher because they understood that the health community was doing a better job of protecting them and so forth. So that's what you're seeing in some of the medical side, is that piece of it. Going forward, we do not, as Kim mentioned, we do not anticipate COVID being an additional cost driver. So the strains have become increasingly less harmful, which is nothing that we can completely bank on, but is definitely a positive trend. Treatments have gotten better, more people have gotten vaccinated, and more people have had the disease, so that's bearing on it. We did inherit some new mandates with respect to testing. So we are paying for basically all of the testing right now, which is a cost driver. The net effect on premium growth is pretty close to flat.
Okay. Great.
But the answer to Saludi Mas, that there will not be a snapback and there will not be risk mitigation. That was about 25% out of their 29.88% increase. That will not be there next year.
Actually, it was a little more than that, it looked like. But yeah, I appreciate that. I just want to get that out there. I also look forward to the conversation regarding how we move forward with our PPO plans. But again, I want to thank you very much. If you think you can get any better rates before we come back in July, I encourage you to do that.
We will keep trying until the bitter end.
I appreciate it. Thank you very much.
Thank you. Ms. Green-Ross.
Yes, thank you, Mr. Chair. So I understand very much the difficulties of negotiating with this many variables up in the air all the time, and you guys work really hard, and I'm very impressed year after year at the hard work that you put into this. And I just wanted to ask, I know that it was a huge help, the renegotiated Optum contract with the pharmaceutical rates. Do you have any update on the state coordinated effort to do pharmaceutical purchasing or production?
Yeah,
months ago?
and that's a really exciting development. So the governor has put, I think it's $100 million, into the budget for this year to build a manufacturing site in California to manufacture generic insulin. It would be the first step in an initiative that he identified when he came in, which is generic manufacturing to try to bring prices in the generic space down. Insulin is both a great and a challenging first target. So it's great because we have so many people who depend on insulin, and the prices in insulin have continued to rise dramatically. So it makes sense to put your cards there. Insulin is also more complicated than some other generic drugs to manufacture. It's something sort of between, I think the way that Dr. Logan has described it in the past is sort of between a drug and a biologic. But that seems to be moving forward. Assuming, again, the budget still needs approval. But if that is successful, if the intent is that they would do more of that, I've already begun discussions with Optum RX to kind of put them on notice that if the state is able to do this successfully, that we will need to amend our contract to make sure that we can take full advantage of that.
That's wonderful. And that's also wonderful because I know you and I have talked on about the biosimilars and generics aren't as well regulated, and a lot of them are produced outside this country, so that's another also positive of that. So that's great news. Thank you. Hopefully it gets passed.
Yep.
Thank you. Mr. Pacheco.
Thank you. Thank you, Chairman Beckner. First of all, thank you, Don, and thank you, Kim, for your presentation. I really enjoyed listening to your presentation and providing this is very important and timely information. My question is, first of all, just more a comment and then a question. I noticed that in the healthcare premium trends, the trend of the basic HMO being 4.2 versus the trend of the national, which is 7.11, which are obviously below, which is really good for us. And again, you alluded earlier about the basic PPO being unsustainable in terms of the trends, and Medicare Advantage being negative versus the other national trend being 4.8, and the supplemental being higher than the trend. And what my question is do you feel that that because of inflation, medical inflation, and we recently had, as I think last Friday, we had the labor people sent out the information. It was 8.6%. Do you think that because of the inflation issues and supply chain issues that are going on in the economy, that we may still see this, and this inflation may still be an influencer, a cost influencer moving forward? Or
inflation, general inflation, will absolutely be an influencer, as will a tight labor market. I think it is hard to read the paper on any given day and not hear about healthcare worker burnout, and those folks have been through the ringer over the last couple of years, and in a tight labor market, you have to anticipate that labor costs are going to go up if they're going to be successful in retaining that workforce. Materials costs are also going up across the board, and all of that affects the cost of delivering healthcare services. So, medical inflation and its relation to general inflation is not perfectly linear. But yes, those costs certainly will factor in for the next couple of years, or for however long it takes to rein in inflation.
So in your opinion, we would still kind of anticipate that cost influencer over?
Yeah, I mean, we're seeing some of that in the 2023 rates because it's anticipated already.
So just given that, because let's say for the instance that COVID, as you mentioned earlier, because we're getting new variants and it's getting more, we have better understanding of it. This could still be an influencer. And then my other question is, doesn't relate to this, but it's just with respect to the Kaiser Permanente Senior Advantage Summit that's going to be offered across. Is it going to be offered across all areas where Kaiser is located?
Within the state.
Within the state, but not out of state, correct?
Yes, that's correct.
And do you anticipate many members to enroll in this in the 2022 period, or is it going to be a gradual thing?
Yeah, that's an interesting question. We don't know is the short answer, unfortunately. The premium is a little bit higher.
Right.
It also, it's leaned into some strategies that are make it potentially more attractive to some of our Medicare members. And the cost sharing is lower. So, we're watching these low cost share plans and the plans that have leaned into the supplemental benefits very closely. We are going to continue monitoring our own data over the short and the longer term, both to look at how those products affect costs and ultimately over the longer term how they affect outcomes. The strategy with the supplemental plans and some of the supplemental benefits, as we've talked about before, is improving health. And those were a bet by CMS that paying for things like nutritional meals after hospital discharge or rides to a physician's office are going to, in the long term, not only increase health care for Medicare members, but also save costs because they avoid readmissions in the case of nutritional meals or hospitalizations in the case of transportation to preventative care. So we're monitoring that closely. We will over time to make sure that those plans are performing the way that we anticipate them planning, but we do anticipate migration of members into those plans because of the benefits, and we're hopeful that that will be something that is good for both CalPERS bottom line and good for our members.
Oh, I was impressed by the $0 copay for most services. That was very impressive. Thank you very much.
Thank you. Mr. Rubalcaba.
Thank you. Rob and team, Kim, excellent job. I really look forward as we move forward. I know the rates are not what everybody will see as advantages, but I do see it very beneficial that we're finally at a point where we plateaued, and these are, to use your term, fully priced, meaning the price that is justified. It's based on the design and the risk that the plan carries with it. We do have work to do on the PPO, but I'm looking forward to, and I would ask that we work with the carriers on some sort of materials for open enrollment that will sort of promote what the plans are, especially the HMOs, what they can deliver in connecting with your primary care physician, providing preventive care for those that are healthy or keep them healthy, and if they have chronic disease, that they address that to either maintain their health status or improve it as much as possible. Because until we're able to move a little bit of that behavior, there will not always be a silver bullet of a pharmacy drug that would reverse something that's already happened. So we have responsibility to make sure that we provide affordable and accessible health care, and I'm glad we're moving in that direction. I look forward to your presentation in September and the board's action in the following months. Thank you very much. Thank you for your good work.
Thank you. Seeing no other requests, we do have a couple of commenters from the public. So first call on Mr. Woodson.
Hello, testing. Yeah. Masks and hearing aids don't go well together. Apologize. Okay. Larry Woodson, California State Retirees, Chairman Fechner and board members, thank you for the opportunity to comment today. At stakeholders, we had the opportunity, in a breakout session this morning, we had an opportunity to review these rates earlier and discuss them with the staff, and Kim Malm gave a good overview and answered our questions. My initial take on these preliminary rates is that they are on average not too unreasonable, but there are a few individual plan premiums that are. One basic plan, Anthem Blue Cross Select increase seems unreasonably high at 6.58%, with most due to increased medical costs. And I would point out that Anthem had huge profits in 2021, $6.1 billion, third highest of all the carriers, and I understand CalPERS doesn't consider overall profits, but we see that. But just comparing their increase to the other 11, they're significantly higher. And also with their Medicare Advantage plan, it's even worse at 14.83%. It's almost triple the next highest plan increase. So, and compared to Kaiser Senior Advantage, they're decreasing 6.37%. In the same population of elderly. So, you know, why? Kaiser HMO also stands out, as the chairman pointed out, with a 5.92%. I hope, as in years past, these will come down somewhat in July. The PPO plans are disproportionately high. I understand we'll be interested in hearing more about the plans to address this in the future and give input. In news just yesterday, the Federal Trade Commission announced they're beginning investigation of OptumRx and 5 other major PBMs for their business practices, which they feel drives drug costs much higher than they should be. So this may have an effect on lowering drug costs. So in conclusion, I'm going to be commenting at 5C on the Medicare ACO REACH privatization that's already been implemented, and it affects and will affect and is affecting many CalPERS retirees who've been moved into this program without their consent. Unfortunately, CalPERS has no easy way of knowing who or how many have been moved, and it's somewhat up in the air how this may affect premiums as well. So more from me on that later. Thank you.
Thank you. Mr. Jelencic.
J.J. Jelencic, RPEA. The rates are too high. It shouldn't shock anybody. I've said that for years, and I think everybody recognizes it's true. It's also somewhat against my nature to defend Kaiser, but I would point out that absence the risk mitigation, their rate would have gone up 0.3%. What led to my desire to make a comment is we're being told that this is the last year of the risk mitigation. But if low-cost plans no longer are getting hit with surcharges, they're going to go even though their relative position will drop. High-cost plans won't get the subsidies. They will go up. And it seems to me we're back where we started. So I'm really questioning whether risk mitigation is going away. If the plan is to equalize the premiums, then we've got to do something to recognize the different cost structures and the different populations. You may want to consider going back to your old risk mitigation, which focused on the health conditions of the population of the insured. I thank you.
Thank you. Mr. Takeharts, I understand we have a phone caller.
Mr. Chair, that's correct. We have one call on the phone. David from SEIU, go ahead. One moment. Hello, everyone. Can you hear me?
We can, barely.
Yes.
There you go.
Wonderful. Yes, my name is David Aguinaldo. I am calling in from Chicago. I am part of the CDTFA. I work in the Chicago District Office, and I am a union steward for Unit 1 DLC 799. I am calling because I just wanted to make sure that it is noted that in out-of-state, there are around 300 employees. We have one choice for health insurance, and that is the PERS Platinum plan. And so far as I know, there are no plans to offer anything else. Over the course of the last 4 years, we've seen our premiums increase. So in 2020, my personal portion of a two-person plan was $351. Under the new premiums that were announced today, my portion would increase to $803 today. This year, currently, I'm at $591.56 is my contribution. We have people who are, we have office techs in our office. We have tax auditors who are just starting. So we're, people sitting at around $4,000 a month in gross pay who are being asked to pay, $800 for them and their spouse to be on healthcare plan. I'm trying not to cry in this moment because I've had these conversations with my coworkers who are having difficulty paying their mortgage because their health insurance premiums are so high. We don't have another option. I don't know what can be done to help this situation, but I have called CalPERS, the union, everyone, try to make this more equitable. But as of right now, I still don't see a solution. So I just wanted to make sure that that was on, that we're not forgotten, over in out of state. And again, if we're looking at single payer, a single payer at Kaiser, their likely employee contribution will be $171. Ours will be $402. So over double, almost 2.5 times the premium for our in-state counterparts. That's all I have. Thank you.
We appreciate your comments. Thanks for calling. Mr. Moulds?
Yeah, I really appreciate the call and wanted to this is something that we have been focused on particularly recently. We do not have very many active members in particular who are living in other states, but we do have some. California has offices that are located in select other states, and for some of them it is in fact the case that they only have one option, which is a platinum option, and that is the second highest plan in our portfolio. We had a good conversation with New York State and have conversations that we're looking forward to with some of the other states about possibility of reciprocity in some of these states and piggybacking on their networks. It is a tricky business, potentially requiring statutory changes, but the thing that we landed on, that sort of next steps in New York that is potentially a model here, is making that those networks, the networks that the state retirement organizations use, available somehow to our members. So this is a legitimate problem, and it's something for those folks that we're going to need to fix, and something that I'm working with Rob Jarzombek to dig into at the moment.
Very good, thank you. Ms. Taylor.
So I just want to make sure if there's a way that caller can get my information. That would be awesome. I don't know if Mr. Takerts is even still listening. I'd be happy to provide that to the caller because he's in my union. But I also would like to piggyback on this because Franchise Tax Board, which is my agency, also has New York, Chicago, and Houston offices. They're small offices, but if you combine them with the CDTFA folks and everyone else, we got about 300 or 400 people out of state. So I really I did not know that you guys were looking into piggybacking on some of the retirees programs. That would be awesome because that's a ridiculously high price.
Yeah.
So it takes.
It should never be the only option for.
Absolutely, and I hope that anybody else who's listening from out of state, please give me a call if you're continuing to have these problems, so I can connect you with the right people and we can get you some answers.
Thank you. Seeing no other requests on this topic, again, thank you both and both of your teams for putting this together. It was a lot of hard work, and we appreciate the outcome. So thank you.
Mr. Fechner, can I, are we done with public comment, or is
No, we haven't gotten there yet.
Okay, then I will wait until the very end.
Okay. All right. Next item is 5B, summary of committee direction. Mr. Moulds, Mr. Sweeney, either one of you have any summary of committee direction?
I have two. The first one is to continue working with our plans between now and July to see if we are able to find additional decreases in premiums. And the second one is to continue looking into this issue of out-of-state networks and options.
Very good. And I will add one more to your. Mr. Moulds?
I'll do this now. I just wanted to take a second. Sorry, parliamentary procedure is not my specialty.
It is mine, so.
Well, good. Then we're in great company. I wanted to take a second and thank, and I really appreciate you recognizing our team, but I wanted to take a second and do it as well. It is just a terrific team. They have worked very, very hard under very difficult circumstances, and it is just a joy to work with them. I want to thank Diana Dooley, who is not here. She is in Belize celebrating her 50th wedding anniversary, but she has gracefully came out of retirement to help us with some of the rates work, and has been just a terrific addition to the team. I especially want to thank Ms. Malm, who has taken on this role as a second job. She is continuing to lead her day job division and do this in her spare time. I have only the best things to say about her. She is, as you all know, as loyal as they come to CalPERS, and as dedicated as they come, period. Smart as all be. And we would not have been able to get to this point without her. So thank you for taking on the extra work, and for being such a wonderful colleague. And we're hoping that after we're done with this, she goes back to just one job.
Thank you for your comments. But I will add one more to your list of committee direction, not to preempt Mr. Woodson's comments coming up, but he did start on the comment, and we did read the letter that he sent to all of us. I would encourage you to put together some subject matter experts that you find to have value, that are working on this process that he's going to talk to us about, and have them at a future meeting, maybe in September or November, to come before us so that we can hear from their perspective the equation.
Happy to do that.
Thank you. With that, we move on to 5C. Mr. Woodson, sorry to take some of your thunder, but I wanted to put that out there.
Larry Woodson, California State Retirees again. On Friday last week, as you mentioned, I sent emails to all board members, CEO Frost, Mr. Bowles, providing a report on CSR's findings regarding the dangers of Medicare Direct Contracting Pilot, now rebranded as ACO REACH. It also reports the results of our meeting with Center for Medicare and Medicaid Services management staff. Essentially, REACH has the same dangerous elements and will greatly expand the number of DCEs, now called ACOs, since CMS is allowing new applications. My email included attachments, including number one, CSR's letter to Secretary Becerra asking him to halt the program. Two, the Washington Post article or opinion piece, which first made this known to the public. And then thirdly, a letter from one of our CSR CalPERS retirees that she received informing her that she was now part of a DCE. And then lastly, I sent the CMS list of 99 29 already approved DCEs nationwide, a disproportionate 29 of which are in California. And I recently discovered Sutter Health applied to become a DCE and was granted, and they have 1,140 primary care providers as DCE providers. They take all their patients with them against their, without their knowledge. CMS Center for Innovation implemented this program in 2020 in the last days of the Trump administration, which moves traditional Medicare enrollees into a direct contracting entity, DCE, without their knowledge or consent and without congressional oversight. The payment model for DCEs and REACH is similar to Medicare Advantage. Instead of paying doctors and hospitals directly for care, Medicare gives the middlemen, DCE or ACO, upfront money to cover a defined portion of each senior's medical expenses, allowing the DCE to keep as profit what they don't pay for in care over the year. This incentivizes them to deny services, exaggerate diagnostic codes, both in number and severity. This capitation practice has been identified in Medicare Advantage plans as resulting in billions of dollars higher annual costs to the Medicare fund by MA plans over traditional Medicare fee-for-service. Any type of company can and is applied to be a DCE, including commercial insurers, private equity companies, new startups, even dialysis centers. 13 of the 99 approved DCEs have little or no experience with Medicare beneficiaries. An analysis by 2 former doctors who are directors of CMS estimates that DCEs could spend as little as 60% on care and keep 40% overhead and profit. Both doctors oppose that program. In conclusion, opposition to this program is gaining momentum. However, much more is needed since CMS is expanding it. A letter from CalPERS to President Biden and Secretary Becerra on behalf of CalPERS retirees on original Medicare could have a significant impact. We hope you'll seriously consider this. Thank you.
Thank you. All right, seeing nothing else coming before the committee, this meeting is adjourned.